During this video, we'll explain what's involved in a laparoscopic biliopancreatic diversion, or BPD. This is a weight loss procedure which has a number of variants. The key principles are demonstrated here, but it can vary depending on your personal requirements. Laparoscopy is a type of surgical procedure that allows a surgeon to access the inside of the belly and pelvis without making large incisions in the skin. It's also known as keyhole or minimally invasive surgery. After anesthesia, you'll lie flat on your back on the operating table. Several small incisions or cuts, each no more than an inch wide, will be made in your belly. The number and location will vary depending on your personal requirements. One of them is usually next to your navel. An instrument called a trocar will be inserted through one of these incisions and into your abdomen. It has a spring-loaded mechanism that withdraws the sharp tip immediately after it passes through the abdominal wall. A short tube called a port is left in place to allow access to the inside of the belly. A gas, usually carbon dioxide, will then be inserted to expand your belly and help the surgical team view its contents more easily. Next, the laparoscope, which is a high-definition camera, is inserted. The images will be projected to a monitor for the whole team to view in real time. The inside of your abdomen is carefully examined. Then, a variable number of further ports are inserted through which a range of instruments can be passed. During the first part of the procedure, the size of the stomach is reduced by stapling it. The staples can be placed in a variety of locations to achieve this, depending on your requirements. The second part can vary again, depending on your requirements, but usually involves the division of the small intestine. This step separates the flow of food through the digestive tract from the flow of bile out of the liver and gallbladder, and the flow of pancreatic juices from the pancreas. They are joined together near the large intestine to allow mixing of these two functions. The combined effect is to reduce the size of the stomach so you feel full sooner. Also, the small intestine length is shortened to reduce absorption of calories. Thirdly, it still allows your body to use the digestive enzymes from your liver and pancreas. This should make you feel full more quickly and help with your weight loss program. Before finishing, the surgeon will take one last look around for any bleeding or areas of damage. Once satisfied that the procedure has been completed, the instruments and ports will be removed. The carbon dioxide gas is released. Occasionally, you may have a wound drain left in place. The incisions will be closed with sutures or skin staples and covered with dressings. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.